U.S. overdose deaths fell by 27% last year.
Well, that marks the largest one-year decline ever recorded. In the big story today, we're going to take a look at the decrease in overdose deaths and why Ohio is seeing the biggest drop. Plus, what lawmakers on the state and the federal level are doing to continue that trend. Overdose deaths is the big story today.
The CDC estimates there were more than 80,300 drug overdose deaths in the U.S. during 2024. That's 30,000 fewer drug overdose deaths than in 2023. The agency expects annual drug overdose deaths to reach their lowest level since 2019. All but 2 states saw declines last year, with Nevada and South Dakota seeing small increases. Now here in Ohio, where we've been hit hard, the drop was even more noticeable, with drug overdose deaths declining last year by 35%. One person who knows the destructive effects of powerful drugs firsthand is Tyler Mullins.
You think you're buying something from one guy and you get it from another and it's 10 times as strong and you end up, dead. I've had a lot of people that thought that this couldn't happen to them.
Experts say more research needs to be done to understand what drove the reduction, but they mentioned several possible factors. Among the most cited were expanded addiction treatment, shifts in how people use drugs, the growing impact of billions of dollars in opioid lawsuit settlement money, and the number of at-risk Americans is shrinking, with teens and younger adults moving away from the drugs that cause the most deaths.
Well, another factor contributing to the decline in deadly overdoses is the increasing availability of the overdose reversal drugs like naloxone. And the most common brand name of the drug is Narcan. It was approved for over-the-counter sales back in 2023. And you can find the nasal spray in pharmacies, libraries, and workplaces.
There's this stigma surrounding Narcan that you're admitting that you have a drug use problem. Well, not necessarily. If you have an AED in your lobby, does that mean you have a heart attack problem? No, you're just preventing an accident in case it does happen.
Experts say increasing education and enforcement efforts have also contributed to that decline in deadly overdoses.
In Ohio, lawmakers are pushing to expand access to overdose reversal drugs in schools, and the House passed House Bill 57 this month. That bill ensures schools electing to stock overdose reversal drugs like Narcan must also have clear policies for storage, administration, and emergency response. The bill also allows schools to accept donations to purchase Narcan. House Bill 57 now heads to the Ohio Senate for consideration.
Meanwhile, in 2023, Wood County rolled out 3 vending machines that gives the public access to Narcan kits. The vending machines are located at the Wood County Health Department in BG, the Midwest Recovery Center in North Baltimore, and Harbor in Perrysburg. In order to use the vending machine, the Wood County Alcohol, Drug, Addiction, and Mental Health Services Board says first, you need to call a number. It's 419-567-NOOD. Then you answer 10 quick questions, and it will give you a code to put in the machine so you can access a free Narcan kit. And the Ottawa County Health Department also placed a Narcan vending machine outside of its building in Port Clinton. It's a bin outside the building that allows anyone to walk up, reach in, open the door, and grab out a small naloxone nasal spray. And the free service is an extension of the health department's ongoing efforts to get Narcan in the right hands.
Recent opioid lawsuit settlements between drug manufacturers, distributors, pharmacy chains, and other businesses were also a main driver in decreasing those overdose deaths. The deals over the last decade have promised about $50 billion over time. That money is to go to a variety of programs, including supportive housing and harm reduction efforts. However, what each state will do with the money is right now not known, with some states having the choice to walk away with the money and do nothing, or using it on Narcan and other efforts.
Now, some experts worry that the recent decline could be slowed or stopped by reductions in federal funding and the public health workforce, or a shift away from strategies that might actually be working. Now, the Health Secretary, Robert F. Kennedy Jr., has stated that overdose prevention efforts will continue, but some public health experts say cuts mean the work will not go on at the same level. At a summit last month, RFK Jr. mentioned that prevention, education, and community are key to stopping the overdose crisis.
We have to do all of the nuts and bolts things that you are all involved with, the practical, pragmatic things. We need Suboxone, we need methadone, we need naltrexone, we need Narcan, we need good fentanyl detectors that can detect it on pills, et cetera, so the kids are less likely to overdose. We need prevention. We need education.
Now, this push comes as the Department of Justice cuts hundreds of grants aimed at fighting opioid abuse.
And if you're just now joining us, or if you'd like to see this big story again, you can download our 13 Action News app. It's available as a free download in your phone's app store.